Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, March 4th, and this is our COVID briefing. We've now had 8,230 cumulative positive cases in Missoula County to date, with 10 new cases since yesterday. We've had 82 deaths associated with COVID-19. We currently have 107 active COVID-19 cases, and we have 2 Missoula County residents and 2 out-of-county residents currently hospitalized in Missoula County. Our current average incidence per 100,000 people has now dropped down to 11. The state of Montana is reporting 100,531 cumulative COVID cases, which is up 181 new cases since yesterday. There are now 1,657 active cases with 73 hospitalizations across the state, and there have been 1,375 deaths related to COVID-19 statewide. The University of Montana has had 672 cumulative associated cases since the beginning of fall semester back in August, with 1 new case reported since yesterday, and there are currently 12 active associated cases. The state only updates our vaccination data once a week on Monday, so the numbers have not changed since my last report. To date, there have been 29,566 doses of COVID vaccine administered in Missoula County, with 11,319 people having received both the first and second dose of the vaccine. We're now seeing an increase in the amount of vaccine coming into the county. We're still receiving allocations from the state of approximately 1,500 doses per week, but we're now also receiving federal allocations to some local pharmacies, as well as to Partnership Health Center, which is our federally qualified health center here in Missoula. So today I'm going to talk about vaccine phases and where we now are, vaccine appointments, and COVID variants that have now been identified in Montana. As of today, we've been able to officially move to opening up vaccination appointments to everyone who fits in the 1B phase. This includes people aged 70 and over, Native Americans and people of color, people aged 16 to 69 with certain qualifying health conditions. Those qualifying health conditions are cancer, which includes anyone who has had any type of cancer, even if you're in remission, chronic kidney disease, COPD, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, weakened immune system from solid organ transplant, and severe obesity defined as having a BMI equal or greater than 40, sickle cell disease, and type 1 or type 2 diabetes. This decision was made because appointment bookings slowed significantly this week. This did take place much sooner than we were expecting, as we thought it might actually be mid-March before we were able to fully open 1B. We estimated 16,500 people would qualify in Tier 1 of Phase 1B, and our current data indicates that roughly 8,200 people actually got vaccinated while Phase 1B Tier 1 was open. We are doing our best to make data-driven decisions as to when the next phase and tiers will open, and used the census data to help us determine how many people would be in each phase and each tier. Next, I want to talk a little bit about appointments. We are working really hard to spread the word about our vaccine appointment announcements, but we would appreciate it if you could reach out to your family, friends, and neighbors who may be struggling to find vaccine information. The local news has reported on our clinics. We make social media announcements. We have announcements on the radio and in the newspapers, but some people are still struggling to find these announcements. So if you have a neighbor, friend, or family member who may not have internet access or may not be as socially connected, please check on them and see if they need help finding information on vaccines. And again, I want to direct you to covid19.missoula.co. That's the webpage where you can find the most comprehensive information about where you might be able to get a vaccination appointment. So we are starting to see a lot of national reports about vaccine guilt. Some people may feel guilty that their race, ethnicity, or their BMI helped them qualify for a vaccine, and they aren't getting vaccinated because they worry that there are more qualified people out there that need the vaccine more. We want to assure everyone that there is absolutely no reason to feel guilty if you qualify for a vaccine. We want to encourage everyone to take the vaccine once they qualify. Getting vaccinated is in no way selfish, and by getting vaccinated, you're helping our community as a whole because you're contributing to our herd immunity. Both infectious disease experts and dietitians agree that it's very important for people who may be struggling with obesity to get their COVID vaccination as soon as you're eligible for it. Vaccine supplies are increasing, so don't feel like you took a vaccine from a more deserving person by getting it. In the coming months, we are going to have enough vaccine nationwide to vaccinate anyone who wants it. Last, I want to let you know that the state health department confirmed with us that there are now 3 cases of UK variants that have been identified in Gallatin County. DPHHS says that these all occurred in younger people, and those younger people who contracted it recovered just fine. This is a variant that is more contagious than the strain of COVID-19 that we've been seeing up until now. We want to remind everyone that masks and social distancing are still really important. If the variant is popping up in Gallatin County, there's a good chance that it could end up in Missoula soon if it's not already here. We know that everyone has COVID fatigue. We're all tired of hearing it and having to practice all of these prevention measures, but the end is near, and the end of the pandemic will only come sooner if we continue to use all the tools in our toolbox to stop the virus. So please keep wearing your masks when in public or with people outside of your immediate household. Wash your hands frequently, practice safe social distancing, and please get tested if you begin to experience any symptoms of COVID-19. So that's it for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so you get notified when additional videos are uploaded. You can check out our webpage at missoulainfo.com for lots of great information there. If you are interested in trying to find out where you can schedule a vaccine appointment, you can check out covid19.missoula.co, and there's lots of information there about which places are having clinics for vaccination appointments. Follow us on Facebook at the Missoula City County Health Department Facebook page, and you can call 258-INFO to help getting scheduled for a vaccine once the clinic appointments open up. If you don't have internet access, you can also call 258-INFO if you would like to schedule a test for COVID-19 or if you just have general questions about COVID. So until next week, everybody, stay healthy.